Hello everyone. In this tutorial, we will learn more about the transformative role of virtual reality in healthcare training. Healthcare training has traditionally relied on a combination of theoretical education and hands-on practice. However, as the healthcare landscape becomes more complex, traditional training methods often struggle to keep pace with the demands of modern medicine. Virtual reality has emerged as a transformative tool, offering immersive, interactive, and highly realistic experiences that bridge the gap between theory and practice. So, what is virtual reality in healthcare training? Virtual reality in healthcare training uses advanced simulation technology to create a 3D virtual environment where healthcare professionals can learn and practice. These simulations replicate real-world medical scenarios, enabling learners to perform procedures, diagnose conditions, and respond to emergencies in a risk-free setting. There are 5 key applications of virtual reality in healthcare training. 1. Surgical training. Virtual reality allows surgeons to practice complex procedures with unparalleled precision. Using haptic feedback devices, trainees can feel the texture and resistance of tissues, ensuring a realistic simulation. For example, some virtual reality companies provide platforms where surgeons can rehearse procedures multiple times, improving their accuracy and confidence before entering the operating room. The second use of virtual reality is in medical emergency response. Virtual reality simulations create high-stress environments where healthcare professionals can practice responding to emergencies like cardiac arrests, trauma cases, or mass casualty incidents. These scenarios enhance critical thinking, decision-making, and teamwork skills. The third application of virtual reality is anatomy education. For medical students, virtual reality brings anatomy to life. Platforms such as 3D Organon allow learners to explore the human body layer by layer, interact with organs, and visualize complex systems in a way that textbooks and cadaver labs cannot match. The fourth application is in mental health training. Virtual reality is also being used to train therapists and counselors in managing patients with mental health conditions. Simulated patient interactions provide professionals with the opportunity to refine their communication and counseling skills in a controlled environment. Finally, number 5 is nursing education. Nursing students can practice tasks such as administering injections, setting up IV lines, and patient assessment in virtual reality simulations. This ensures they gain confidence and competency before engaging with actual patients. We can also summarize the benefits of virtual reality in healthcare training in 5 main categories. 1. The risk-free learning environment. One of the biggest advantages of virtual reality is the ability to make mistakes without real-world consequences. Trainees can experiment, learn, and improve without putting patients at risk. 2. The cost-effective training. Traditional training often requires physical resources like cadavers, medical equipment, and specialized labs. Virtual reality eliminates these costs by providing reusable digital simulations. 3. The enhanced retention and engagement studies show that virtual reality-based training improves knowledge retention and engagement compared to traditional methods. The immersive nature of virtual reality helps learners remain focused and retain information longer. 4. The global accessibility. Virtual reality makes high-quality training accessible to professionals worldwide, especially in remote areas where resources are limited. All that's needed is a virtual reality headset and a compatible platform. 5. The real-time feedback. Many virtual reality systems provide immediate feedback on performance, allowing trainees to identify areas for improvement and refine their skills. As we discussed in the previous tutorial, despite its benefits, virtual reality in healthcare training is not without challenges. 1. High initial costs. While VR reduces costs in the long term, the upfront investment in equipment and software can be prohibitive for some institutions. 2. The technological barriers. Not all learners are comfortable with VR technology, and some may face a steep learning curve. 3. The simulation limitations. While VR is highly realistic, it cannot fully replicate the complexity of real-life patient interactions. What about the future of virtual reality in healthcare training? As the technology continues to evolve, its potential in healthcare training will expand. Emerging trends include 1. AI integration. AI-powered VR simulations that adapt to the learner's skill level and provide personalized training. 2. Remote collaboration. Virtual reality spaces where healthcare teams can collaborate and train together even if they are in different locations. 3. Wearable virtual reality devices. Advances in wearable technology will make VR more accessible and comfortable for extended training sessions. To summarize, virtual reality is revolutionizing healthcare training, offering innovative solutions to age-old challenges. By combining immersive learning experiences with cutting-edge technology, virtual reality equips healthcare professionals with the skills and confidence they need to provide exceptional care. As adoption grows, virtual reality will undoubtedly play a pivotal role in shaping the future of medical education and training. For healthcare institutions, investing in virtual reality training is not just an opportunity. It is an essential step toward building a more skilled and prepared workforce in an ever-evolving industry. Thank you for your attention, and see you in the next tutorial about the augmented reality and its promising role in healthcare. Good luck.